If you're a parent, you need to know this. The EEE virus is a threat for children under 15 years of age. Eastern equine encephalitis, or EEE virus, is a rare but deadly mosquito-borne disease. People who work and participate in recreational activities outdoors in endemic areas are at increased risk of infection. This year, it's been detected in multiple states, including New York, Massachusetts, New Hampshire, New Jersey, Vermont, and Wisconsin have reported cases of eastern equine encephalitis. Maryland and Kansas report state-level data only. South Carolina reports state-level data only for human disease cases. The virus causes severe brain inflammation and has no cure or vaccine. With a mortality rate of around 30%, it's crucial to protect yourself and your family. Health officials urge everyone to take precautions, use insect repellent, wear protective clothing, and eliminate standing water where mosquitoes breed. The virus is particularly dangerous for children under 15 and adults over 50. Symptoms can range from headache and high fever to seizures and coma. Eastern equine encephalitis virus is transmitted to humans through the bite of an infected mosquito. Human eastern equine encephalitis cases occur relatively infrequently, largely because the primary transmission cycle takes place in and around swampy areas where people are less likely to go. Eastern equine encephalitis virus transmission is most common in and around freshwater hardwood swamps in the Atlantic and Gulf Coast states and the Great Lakes region. All residents of and visitors to areas where eastern equine encephalitis virus activity has been identified are at risk of infection. New England prepares for mosquitoes bearing deadly infections. As Massachusetts insect season goes from bad to worse, the risk of mosquito-borne illnesses is hitting a new high. Why it matters. Health officials are urging residents to take precautions against diseases like West Nile virus and Eastern equine encephalitis, also known as EEE. Several towns in Plymouth and Worcester counties began spraying for mosquitoes this week to decrease the threat. What they're saying, the spraying is one part of the solution. It is not the only solution. Plymouth Commissioner of Health and Human Services, Michelle Brady, told NBC 10. Anyone out at night is advised to use strong insect repellent, wear long sleeves and pants, and drain standing water around their homes. Threat level: West Nile virus can cause flu-like symptoms, long-term complications, and in rare instances, death. The Centers for Disease Control and Prevention have recorded 289 human cases of West Nile virus from 33 reporting states this year. EEE has a higher fatality rate, around 30% of infected people according to the CDC. A New Hampshire resident died this month, August 2024, from EE. Massachusetts reported the first case of the disease last week, August 21, 2024. What's next? The mosquito threat will continue until the fall, when hard frost kills off the insects that carry the diseases, according to public health officials. Cases are most commonly seen in the southeastern United States, with the mosquito Culiceta melanura as the primary vector, although other species of mosquito can also transmit the virus. Infected horses and humans do not have enough virus in their blood to be contagious to other animals or people. As such, infected individuals do not need to be quarantined. The disease has a high mortality rate in horses and humans, and as such, is considered one of the most serious mosquito-borne diseases in the United States. The disease has a high mortality rate in horses and humans, and as such is considered one of the most serious mosquito-borne diseases in the United States. What are the clinical signs of Eastern equine encephalitis? The clinical signs of EE often come on abruptly. These can include depression, anorexia, fever, and lethargy. Neurological signs may include tremors, weakness, ataxia, paralysis, seizures, decreased awareness of surroundings, and recumbency. How is Eastern equine encephalitis diagnosed? Eastern equine encephalitis is diagnosed through blood work. Testing can include enzyme-linked immunosorbent assay, ELISA, or polymerase chain reaction, PCR, on cerebrospinal fluid, CSF, samples to identify the EEE virus. How is Eastern equine encephalitis treated? There is no cure for EEE. Treatment largely consists of supportive care for horses with clinical signs, including intravenous IV fluids and anti-inflammatory medications. What is the prognosis for Eastern equine encephalitis? The prognosis for horses diagnosed with EE is very poor. The disease has a high mortality rate, with up to 90% of infected horses dying from the disease. Horses with neurologic signs that become unable to stand on their own have the poorest prognosis for survival. Horses that do survive can have permanent brain damage. How can Eastern equine encephalitis be prevented? The American Association of Equine Practitioners, AAEP, recommends the EE vaccine as a core vaccine. Horses should be kept up to date on vaccinations, which are usually administered yearly. Boosters may be recommended more frequently in warm climates with year-round mosquito activity. Boosters may be advised when outbreaks occur. Work with your veterinarian to establish an appropriate vaccination schedule for your horse and situation. In addition to vaccination, it is important to practice good vector control to protect your horse from EE. Use insect repellents and keep horses in at night when mosquitoes are most active. Eliminate mosquito breeding grounds such as standing water, brush piles, and old tires. Stock tanks and water troughs with mosquito feeding fish. Stay safe and stay informed. Protect yourself from the EEE virus.